Hello everyone. Today we have a very interesting session. Someone I personally have looked up to, and there are so many questions around obesity. So today we have a very special guest who's gonna join us very soon. I'm sure he's performing surgery now. Wait and hang on till we introduce him. Hi sir, how are you?
Yes, pleasure meeting you.
Same here. Seems to be a very hectic day for you.
Hectic day, but just everything is over now.
Wow.
All for you.
Lovely. Thank you so much for the time.
Yes.
As I said, the much awaited episode. Today we have the very special guest, Dr. Shashank Shah, who is known as world famous bariatric surgeon. Welcome to my show. A person whom I have been inspired by, Dr. Shashank Shah. I have been very keen for this conversation because this particular topic is a concern worldwide today.
Worldwide.
Okay. I was reading an article recently. Close to 1 billion people across the globe are found to be obese. India, the obesity rate has increased from 1.2% to close to 20%. So, wanted to understand what is happening in the current scenario and what is your take on that?
So India has unfortunately become the world capital of diabetes and slowly progressing towards being a capital of obesity. It's growing worldwide, and the reason is environment, preservatives, artificialization, modern lifestyle, coupled with genetics. All these things are in fact affecting the metabolism, body's hormones, and these are called environmental disruptors of endocrine system. So it's not a mistake of a single person. It's overall movement which is leading the world to a pandemic of obesity and obesity related diseases. And it needs some action.
So, you have been now in this field for 3 decades, close to.
Yes, 3 decades.
Right? And what you are seeing the future gonna be if the rate continue to grow at this pace? How you see this particular issue becoming a pandemic in next decade or so?
Yes, it's scary unless there is a significant awareness of obesity as a disease and action plan. I believe obesity related diseases, type 2 diabetes, heart disease, joint diseases is going to be a major health hazard for all countries. For developing countries, it is still more of a challenge. Unfortunately, incidence of obesity in pediatric age group, adolescents, is very rapidly increasing. We see diseases setting in at an early age, and that is really scary and a big task for society, for educationists, government, doctors, clinicians, and even family members.
So, let me ask you from that question, what is the root cause of obesity?
The root cause, unfortunately, is whatever we use as preservatives. We use everything ready-made, activity is coming down, we are bound to social media, TV, overall activity is less. At the same time, like an evolution, the hormones of metabolism are getting affected. Metabolism is becoming slower. Calorie dense rich food is adding fuel to this, and altogether we see obesity growing everywhere.
Okay, on that note, there is a lot of gyms coming out, lot of keto diet, XYZ diet. I know my friends have gone through multiple diet, multiple such session, and the result has been adverse. So, for a common people like us who suppose are a little on the obese side, what is the instruction they should follow? Because there's so much info overload, we really don't know. I know is a very close friend of mine. She runs about close to 10 kilometers every day. She does diet, she does keto, but still her obesity is increasing. And there's nothing can be found. What is your, how do we break the myth, and what is that suggestion you want to give it to them?
Very important question and thought process. Everyone does feel that eating little less, exercising more, doing some diet automatically is going to give weight loss. Obesity actually is a disease. If you have a disease, you have hernia, you have cancer, you have cough, you go to a doctor. Unfortunately, only for this disease, people try their options on their own. If they are not scientific, they are going to fail. Obesity is defined as a disease and not just a lifestyle disorder. This is our position statement of Indian society, written by the society. And that is why we see people who enjoy, party, and still remain normal weight.
Yeah.
And those who struggle, try to diet, try to exercise, and still they keep on gaining weight. Actually, diet, lifestyle change, being calorie conscious is important. It's important for health, for better health. It is never only a tool for every type of obesity. Let me give you an example. When obesity just starts, you start gaining weight and you realize that your diet and exercise probably is going wrong, and you correct at that time and maintain it for a longer time, it can work. Like any disease in a different stage. But as the stage of obesity progresses, then you are from 5 kg excess to 10 kg excess to 20 kg excess. Any disease has progression, this also has progression. After it progresses to a certain grade, then if you want to try something basic, it is unlikely to work except for a short duration. So what happens? A person comes to me, he says I was 95 kgs, I followed X, Y, Z, multiple diets, I came down to 85. Those diets are not sustainable for life. So I stopped them, I went to 102. So in fact it becomes a treatment of weight gain over years. Even though in 3 months, 6 months they have satisfaction of losing some, but if you look at long term, eventually they gain weight, and the main reason is the root cause could be hormonal, the root cause could be metabolism, and it is not treated. And as an individual, you are trying to treat a disease on your own without knowing the science, it is very likely to fail.
On that note, my next question. Can bariatric surgery reverse diabetic?
Yes.
Because I remember there was a research paper you presented to American Association of Diabetics, and
Yes.
that was given the best worldwide research, and there was a lot of paper I read in the
Yes.
net. So can you give me some example on that?
Okay. Let me tell you how we started.
Okay.
Maybe 20 years back, we started bariatric surgery, thinking that the person will lose weight. Patients with diabetes, medications, they were operated. And next day, our diabetologist was surprised, diabetes was gone. Nothing changed, weight loss did not happen, but diabetes disappears. That means something in the body in the form of hormones which stimulated pancreas to work better change. We thought if that is the case, then why only for extremely obese people? Even others who have diabetes which cannot be controlled, they are on insulin and complications set in. If we treat their diabetes with the same procedure, will their diabetes reverse? And this was the first research done for laparoscopic metabolic and bariatric procedure to reverse diabetes. And almost 70% patients had their diabetes reversed as compared to those who were on medication. This research was a path-breaking research, and the American Diabetes Association gave the Vivian Fonseca Scholar Award. This is probably the only award a diabetes association has given to a surgeon, because all others were medicines. This is now being part of the guideline of treatment of type 2 diabetes. That means anyone with type 2 diabetes, with prominent belly, on medications, on insulin, still uncontrolled, cannot follow diet, and diabetes can affect their nerves, their sexual function, their heart, their kidney, and if it is progressive and nothing can work, today they have a solution. A simple daycare keyhole treatment, and in 24 hours diabetes is gone, they don't need medication, they don't need insulin, and they are free from diabetes for years together. Thousands of our patients are free from diabetes, and every year they celebrate their freedom from diabetes. Of course, they have to take some care, remain on a healthier style, but much better than what they were earlier.
So on that question, if diabetes cure would have been addressed by this surgery, why people are not, is it people are not aware, or people feel there can be a side effects?
So it's a keyhole procedure, it's a surgery, so it's not for everyone. But those who cannot control it, Those who have tried everything, all medications, insulin, and still the disease is progressive, slowly diabetes specialists are recommending this. The branch is definitely growing, but the awareness is still not there in the mind. The thought is once you have diabetes, you have to live with it for life. But I think times have changed. This procedure of metabolic and bariatric surgery, it's called metabolic surgery because it changes the metabolism of blood sugar control and reverses it to normal blood sugars. And all complications related to diabetes, fortunately, can be reversed, stabilized, or prolonged.
Excellent. So, friends, anybody suffering from this issue with diabetic, you have an answer right there. You know, doctor beautifully said how this surgery can reverse the diabetic. So on that note, how a patient would understand that I need a surgery now? Because I know people must have tried multiple things did not work. They start taking insulin, right? Yes. Many people have reversed it through the control of the food.
Food, yes.
Many times, so when people should understand I should control through food or surgery, how they'll be able to differentiate that?
Controlling on food is an interesting way to treat it, but it's called very low calorie diet, 800 calories, less than one meal in 24 hours.
Okay.
People have tried that, but then it is not sustainable. Whenever a body tries to do this, body's compensatory hormones like ghrelin, hunger hormone, hormones of metabolism start working against the body. Person cannot control because the hunger hormone talks to the stomach and brain. Person loses control. It is unfortunately thought as lack of willpower, but it's not lack of willpower, it's a hormonal action. And no one can fight against physiology. But you rightly asked, who should consider this surgery? Anyone who has excess weight which is giving rise to diseases. And the diseases may be in the blood, maybe because of excess weight, maybe because on the mind. That means the disease can be diabetes, high cholesterol, heart disease, increased uric acid. These are in the blood, they are called metabolic diseases. But for someone, the excess weight is destroying their knee joints. Excess weight is giving backache. They are breathless while walking. The weight of the belly is falling on the chest. They feel breathless on walking. They snore at night. These are weight-related complications. If your excess weight is giving these complications, or sometimes with weight, with diabetes, the sexual function gets suppressed because fat, unfortunately, reduces male hormones levels in a male. It converts male hormone into female. And in a female, the reverse happens. Fat converts female hormone into androgens, male-like hormones. So the sexual libido goes down, sexual activity goes down, plus inability to move, pain, and maybe all these things together give rise to some psychological, social challenges in that person's mind. These are also diseases and problems. If weight is giving all these problems and you are unable to save yourself from that, a scientific option is deserved. And everyone deserves to be happy, healthy when there is a scientific solution available. So these are the ones who are fed up with diet, exercise, all attempts, and there is a rebounds, and people blame them that you cannot follow, you eat more, or you don't work. I think this is a blessing for all of them. One-time solution can reverse all these problems at one time.
Lovely. I think this was a information not readily available to many people. And I'm glad, thank you for coming on the show, because this actually going to make people aware that what is available. Now, with that, the last answer you told that many people do 1 meal a day to reverse the diabetic, whereas body's requirement 3 meal a day.
Yes.
So now to be able to do 1 meal a day to reverse diabetic, they might get a temporary result. What is the side effect of 1 meal a day? Because I know my friend who's been doing it just to kill that hunger. She keep on sipping black coffee, okay, throughout the day whenever she's hungry, and then night she will take 1 meal and she reverse the diabetic. She's nearing 50, but is there a side effect of doing this 1 meal a day?
If you restrict your diet, automatically the nutrients required may not be given to the body. Multiple nutritional deficiencies, hair fall, maybe sometimes the skin tone is disturbed. Side effects exist with every intervention. The biggest challenge of this intervention is rebounds, weight regain and relapse of the disease, because how long can one survive on this? Slowly, that initial vigor to follow that fades away. But then what you lose, you gain much more than that, and that can be a biggest disadvantage.
So now with this keyhole surgery, which the entire life can be changed, what may be side effect people who opt for this surgery?
Very good question. The side effects are probably same as very low calorie restricted diet. Anyone who's on diet needs vitamin supplementation, some other protein supplementation, sometimes you need iron. So in this procedure, appropriate vitamin supplements is the only thing which is a requirement. I wouldn't call it a side effect, because if you look at side effects of all these diseases like diabetes, cholesterol, joint diseases, which need interventions which can be life-threatening, as against that this is nothing. But in fact, what we found that those with overweight, different grades of obesity who come to us already have multiple deficiencies. But after surgery, their commitment increases. We educate them better. So we did a study in which we found that the nutritional status of patients after metabolic and bariatric surgery was better than those who did not undergo surgery.
Wow.
Because they are aware and standardized formulations do exist.
Lovely. How many surgery have you performed on this?
Bariatric surgeries should be over 15,000.
Wow.
Total number of surgeries should be above 45,000 over last 34 years, which is on record.
But close to 50,000 surgery.
Close to 50,000 surgeries.
And literally 100% result.
Very successful. Touch wood, we follow a protocol. We follow all the scientific guidelines. All these bariatric surgery, everyone has lost weight. Everyone has reversed their disease, and everyone almost feels like changing their birthday to the day of procedure because their new life starts again.
Okay, with that, I remember reading an article. You got a limca book of record as well as World Book of Record for performing surgery of a lady who was some 320 kgs.
Yeah.
And I remember reading that somewhere. And that kind of, you changed her life completely. Some light on that particular surgery, how it happened.
I must say, 310 kg Indian lady came to me, 5 feet breadth. We had to put a special truck to transfer her because she was bedridden for 8 years.
Oh my God.
We investigated, but the thought came to my mind, why did anyone allow her to reach 310 kilograms? I felt very sad. But she went to many endocrinologists, dietitian in the world. Her father said, whatever he earned in 12 years, he spent on her treatment with diet, gym instructor, endocrinologist. No one could help. One thing I realized, no one can become so big just by eating more. So there has to be some disease. So we prepared her, we treated her, and at the end of 5 years, she lost 285 kilograms. She came to 85 kg. She could drive her own car. She started working. She's earning money on her own. This transformation is unbelievable. And she herself applied for the World Book of Record and India Book of Record. Highest weight loss after surgery or any treatment at the end of 5 years. 285 kilograms lost.
Fantastic.
So very rewarding. Similarly, we treated a British patient who was also 300 kg. He lost 200 kilograms, but this lady scored much higher.
Oh my God, 285 kg loss just by one surgery. And that, how many times post-surgery? How many days?
That was at the end of 5 years. That means she waited for 5 years, her life transformed. At the end of 5 years, when looking back, she could not even see the sunlight. She was on a bed. 2, driving her own car, going for shopping, enjoying and earning on her own.
This is such a life transformation. So if that is the case, now very talked about wedding of Mr. Anand Ambani. If this is the case which is well known and very well researched, he also on the overweight side. So why do you think they don't perform such surgery?
Let me give you a background. Bariatric surgery started way back in 1965.
Right.
They evolved. They are extremely standardized. And there are guidelines. If the body mass index is more than 40, a person should benefit from metabolic and bariatric surgery. People still feel that diet, exercise is a natural way. They feel that will happen. It works for some extent, to some extent, but eventually there is a relapse. Even bariatric surgery has a life. So, I believe that anyone who has BMI of more than 40 and deserves bariatric surgery should follow evidence-based guidelines. Another apprehension is someone is very big. There is a fear of anesthesia. There is a fear of surgery. There is a fear of risk. However, this is very standardized. We have treated probably over 100 patients beyond a weight of 200. The protocol for safety is well set. We follow it very strictly. And as on today, we can say it is very safe and a standard procedure. So anyone should enjoy benefit of that. I would be able to tell about any person when I see the entire medical history. So I'm talking about what should be the ideal guidelines in a population.
So BMI of 40 and above should definitely consider a bariatric surgery.
Okay. Anywhere in the world, same guidelines.
Okay. I think many of us on the BMI, I don't know, I have not checked my BMI though.
40 is significantly high.
Okay.
That means you have at least more than 25 kilograms of excess weight as compared to normal.
Okay, so anybody has more than 25 kilogram of excess weight, please check your BMI, and if it's more than 40, you definitely must consult a doctor on your obesity issue. So I remember BBC and National Geography had come and done a documentary about your facility. That was quite fascinating. Can you share some light on that?
First of all, I must say that I feel very proud that BBC and National Geography found this facility worth a recording for worldwide relay. Years back, 15 years back, I had operated on a boy who was just 7.5 years old and 115 kg. He was in Madhuri Dixit's movie as a drummer, short of a boy, huge. I met him in the ICU 2-3 times, and then the pediatrician said something needed to be done. So I operated on him, maybe way back in 2008. Partly people started criticizing, people appreciated, but BBC noticed it and followed that boy for 10 years.
Okay.
At the end of 10 years, he was a 52 kg tall football player.
Wow.
And then BBC followed his life's history. They came here, they recorded our hospital, the procedures, and declared it as the youngest boy in the world to undergo successful bariatric surgery.
Wow.
Subsequently, National Geography came and recorded procedures for adolescents, young boys and girls. The incidence is increasing. So they recorded how they eat, how they live, what do they eat, what is the junk food in India, Indian junk food, outside junk food, and then eventually the treatment and their journey and who should undergo. So BBC and National Geography did contribute to awareness of obesity as a disease and did give a message that if your obesity is severe, it is right time to get it treated through metabolic and bariatric surgery. But at the same time, I was very proud that a hospital in India and the BBC, they recorded almost for 30 days before making a documentary of 30 minutes.
Lovely. I remember when I walked into your hospital, I saw the wheelchair sizes are very big.
Very big, yes.
Which is not the normal
wheelchair. It is
wheelchair.
designed for those who cannot walk, those who are huge, even wheelchairs, bathroom, operation table, bed, staff training, everything is designed to cater to these people.
If somebody is 150 to 200 or 300 kgs, you require that kind of facility, right? With that, lot of myth around this surgery, right? What is the current myth going on this space?
Okay. One very interesting myth is these surgeons cut the patient's stomach and they cannot eat. And it is wrong. Many of our patients probably eat more than what we can eat. And that is because there is a change in metabolism. Initially, the stomach size is small, but it is elastic. There are procedures where large stomach size can be kept and it can be connected to intestine. So fat doesn't get absorbed, but everything else can get absorbed very well. Some vitamins are needed, but a patient who undergoes bariatric surgery can enjoy eating everything, can party like a normal person. Only our suggestion is it shouldn't be every day. You shouldn't abuse any permission.
Right.
Otherwise, they lead a normal life.
So, mota moti after the surgery, within how many weeks he or she can come back to normal life?
So they lose about 25% of their excess
Right.
in first 3 months.
Okay.
Then maybe similar in next 3 months, little more in next 3 months, and over a year's time, slowly, like how they go from normal to obesity, they slowly transform to normal. And I must say, it is so drastic that if I don't see a patient for 2-3 years and he visits me after 3 years, sometimes it's very difficult to even recognize who this person is.
Okay, absolutely. It will be full of joy to be able to
Yes.
see you transforming people's life. With that, now there's a lot of talks on diet. So my next
yes.
question. I grew up eating rice, chapati, roti, dal,
Absolutely.
Everything. Today people say you should not go low carb, you should not have dinner carb, you should not have the atta ka roti, have jawar bajra roti. Completely cut down rice or bring rice to this one bowl. I remember hearing ghee is a good fat. But today say ghee is bad, you should not use too much of ghee. Now, what is good, what is not? Every other opinion is different than the others. So, should we follow our own diet, what we've been following from childhood, or go by the current scenario, low carb, high protein diet, and then getting confused in the process?
Good. So, let me tell you what is called a thrifty gene hypothesis. How did these thought processes start? Centuries back, our ancestors had to hunt and eat.
Yep.
That means they were not sure whether food will be available every day. So body was designed to live with very less calories. That genetics of less requirement continued. But then the world evolved. You have readily available calories, ready available food, and slowly this thrifty gene hypothesis is someone was living with very less calories is now has abundant calories. Someone who had to work very hard to earn food doesn't have to work that hard to earn food. Diet in every part and every element is important and essential. I wouldn't say no to anyone, but a balanced diet which has more proteins, some carbohydrates. In the fats, there are good fats and bad fats. So, MUFA or polyunsaturated fatty acids are better. Trans fat, oil which is boiled again and again, is an unhealthy fat. Fiber, raw fruits, raw vegetables should be in abundance. And if there is a combination, one can eat everything in moderation. However, if someone already has excess oil in his body, excess fat in his body, I am sure no one would like to add some more oil in his diet because there is always an excess. And so those who earlier times, maybe ladies during pregnancy did not get enough nutrition. For them, ghee was a good source to store fat when there was a need. During starvation, famine, body needs some stores. So fat is that way a protective store. But when this protective store is loaded with excess, it gets converted into a disease. And that is why a smart combination of who needs what needs to be calculated, and then still a balanced diet would still remain a balanced diet. It should be started right from the beginning. It can be adopted anytime in future, but if it is adopted very late, it will not necessarily reverse all those damages. Maybe in spite of that, sometimes if the BMI is high, a person may need bariatric surgery and then has to follow the balanced diet later.
So for balanced diet, what is your balanced diet like? Why don't you tell to our audience what generally you follow?
As much protein as possible. I'm a vegetarian, so vegetarian protein sources. But I love vegetables, green vegetables, fruits, oil is almost negligible because we do get invisible oil from many other sources in our food. So fiber, protein, and some carbohydrate because we don't get feel full without eating carbohydrates. That's our culture. So carbohydrates in moderation, and then trying to remain active. Of course, I am not eating everything healthy. I have to enjoy someday, but then I do compensate by reducing my calories on the other days. So a combination of both. Of course, it may not be possible for everyone. That way I am blessed. But if I deviate a bit, the signs can be seen immediately. But everyone is not blessed. Sometimes, in spite of trying this, metabolism can still be diseased and go against you. Those are the ones who definitely need help.
It just a thing came out because we just saw yesterday, unfortunately, Miss Fogart got disqualified just by for 100 gram
100
extra weight.
grams.
I was reading during semi-final her weight was 49 kgs and just final day ke pehle it was 52.7 and she reversed. She did not eat throughout the night and day and then she was still weighed by 100 gram extra and for which she had to be disqualified. Now generally this sudden weight gain of athlete from 49 kg of semi-final to this 3 kgs extra. How does that take place? Just to understand, like, is it more of a, because they will be always following a pattern.
Yes.
Does it have any other reason to have this additional 3 kg to gain between this couple of days?
Although it's different science, I must say it has got something to do with calories, fluid retention, electrolytes, and a calculation of all those. It is very unfortunate. 100 grams is too less to be unqualified. Even sometimes instrument machine errors can be up to 10 to 20 grams or 50 grams. That means just 50 grams have changed someone's luck. But that means weight is important even in those.
It's very painful, you know.
Very
I sort of
painful,
had
very painful.
almost from the confirmed silver and the gold,
Silver.
and just because of the 100 gram
Very
extra.
sad.
Yeah. So weight is very important, and as you rightly said. Now, my question: did you see during our COVID time, people with obesity disorder had issue with the COVID? Did you see them actually suffering or losing life? People who had the obesity issue compared to the normal people?
It was a very sad time. I'm struggling to explain treatment that obesity is a disease you need to get treated. And worldwide data shows that those who had excess weight already had low oxygen. They were breathless at rest. They had diabetes. Their immunity was suppressed. And those with obesity, diabetes, breathlessness, most of those people had either a serious illness, and unfortunately I saw many people with these diseases who could not be saved. In fact, after recovery from COVID, those who had a narrow escape, they remembered our words and immediately came and got a surgery done. There is one very sad incident which I would like to share. There were two brothers from Bombay who had excess weight and diabetes and they were struggling, otherwise looking normal. One of the brothers got surgery done before COVID. His diabetes disappeared. He was no more breathless. He was active. His oxygen saturation improved. Both of them had COVID, severe COVID. One who underwent bariatric surgery could be saved and his brother could not be saved. Actually, his brother was saying that, let me see his brother's result. I'll do it after a year. And we felt very sad and his brother felt very sad that he could not be saved only because his obesity, diabetes, breathlessness was not treated in time. And COVID probably was one period, unfortunate truth that people did understand that obesity and diabetes are serious diseases which need aggression and attention as soon as possible.
So, friends, as you see, many root cause of many diseases today is obesity. And unfortunately, the obesity rate is increasing. If you can treat it from the root cause, half your problem is over. So people who have a question, have concern, tried diet, gymming, exercise and nothing is working, you know where the solution is. So we wanted to bring this video to you to kind of acclimatize you with what's happening and what's safe. And as doctor said, it's absolutely safe to go through the surgery. It's just a keyhole procedure and then life gets reversed. With that, we have a few rapid fire questions.
Yes, please.
And that's going to be interesting.
I'm worried,
It's
yes.
just the one-line answer. Since obesity is becoming a huge concern, can obesity be traced when the baby is inside the womb?
Very good question. And I must say this is to stress on an important point. Maternal health during pregnancy does affect baby's future development. It is said that if the mother has obesity and diabetes during pregnancy, chances of that getting transmitted to the baby are higher, and incidentally those who undergo bariatric surgery and do not have excess weight and diabetes, there is a trend of less transmission to the baby. So it's not even safe pregnancy, but it is for better health of the baby. And maternal health is not only about this, about nutrition, about culture, about thought process, mental health, and biochemical health, blood health. Everything should be as positive and healthy. Automatically, baby's development in the womb can be much better. Babies all the time listening to what the mother does, think, eat, and do, and how the mother's blood behaves and gets transferred to the baby's body.
Increasingly, we are seeing cancer becoming a common cause to many families. So, does obesity has a role to play for cancer?
Obesity is now known as one of the important reasons to cause cancer.
Oh my God.
Many cancers like breast, ovary, prostate, colon are caused by obesity, and alcohol is thought to be an important reason for liver cirrhosis and cancer. But obesity-induced fatty liver is becoming second commonest cause for liver disease and liver cancers. So now obesity is also known to induce cancers. We try everything to prevent cancer. This is one therapy to prevent cancer and attempt to lead a long normal life.
So much of light, and thank you so much for the conversation. I think a lot of learning today for me and for all my viewers.
Right.
With that, the next stage is going to be rapid fire.
Oh,
we'll make it a little fun-filled.
Absolutely.
And we want to take a deep down to your childhood stories and all, so that my audience get to know.
Definitely.
So Dr. Shashank Shah, as a high schooler, was he known to be naughty or serious?
Well, naughty but a scholar. A naughty scholar, you can say.
Naughty scholar, okay. So today, you are very successful. You have actually run 50,000 surgery. You are on the Limca Book of Records. You have achieved a big name in the society. What are the 3 things contributed you to be here?
Okay. So I must say, unfortunately, my grandfather had cancer of the esophagus. He could not be treated and he expired in 3 months. So my grandmother inspired me to be a surgeon, to be of use to people, to save their lives. And I must say, the job satisfaction is the most important thing which I see. Someone is relieved of pain, someone's life is prolonged, someone's dreams are achieved because of our treatment. So I don't think it's work for me. I love it, it's passion, it's service, but more than that, it is very satisfying. So I enjoy every moment when I see a patient smile and going home happily, whether it's from the outpatient or from the OR.
Beautiful. You're also getting so many blessings from so many patients.
Blessings.
Right. Hindi movie or English movie?
More Hindi movies because I'm here in Maharashtra state. Bollywood is very close.
Of course. And who's your favorite actress?
My favorite actress, I would say there are many. Not favorite.
Top 3. Someone
for acting, someone for looks, someone for overall.
Let me tweak the question. For looks, who's your favorite?
I would say still someone like Madhuri Dixit is my favorite. In olden times, Madhubala was my favorite.
And for acting?
For acting, I still like Amitabh Bachchan, Shah Rukh Khan, and all others actors like Nasiruddin Shah, and maybe some from the art films.
Are you on a weekend mainly on Netflix or your phone or your garden?
No, I think on my weekends I am with my family, with my kids, trying to play, trying to drive them around, trying to chat, trying to imbibe some cultures, or maybe trying to learn what is the Gen Z or the next generation thinking.
Excellent. So when you are in medicine, when you're pursuing medicine, it is a very tough field to get in. Only I think hardly not even point certain percentage makes it through.
Yes.
So what is your advice for people who are actually practicing for the NEET and all the medical related courses?
Very good question. I must say, if you want to be a doctor, if you want to work for longer period, if you are ready to study for 10 to 15 years, or if you are ready to study for lifetime, you enjoy serving people, this is a very good branch. You need commitment, sincerity all the time. You can enjoy, of course, but still, sustained commitment over years with passion, liking, then you will not feel that you are studying. Every knowledge is inspiring. It makes you more mature. If you enjoy more knowledge, maybe medicine is the best branch. If you want to be a doctor, be committed, be sincere, be honest. Future will be automatically with you.
Beautiful said. With that, my next question. Are you a Netflix buff or Amazon Prime buff or not at all?
Neither of them. Neither
So
of
what
them.
do you do your off time?
I read, I search, I of course watch movies sometimes, but whatever the family is watching.
Give me one favorite movie name.
Movie name.
Which you can keep on watching in the loop.
I must say that was about friendship. The movie with Amitabh Bachchan and Rajesh Khanna in their transitional phase. So movies on friendship and relationship are the ones.
Your favorite.
Yes.
Okay. And just a last question. What is your most embarrassing moment so far?
Most embarrassing moment is, I must say, as a surgeon, I want to do something, but you cannot diagnose, and the patient is in a critical condition. I think I feel embarrassed that I studied for last 50 years, practicing for 33 years. Still, there is a question mark, and that is how medicine is. Everything is not open, but not knowing something is still embarrassing. So I study, read, try and upgrade, and it's still a learning process. I must say, I still learn every day.
Okay. With that, I know both the children are preparing for medicine, right?
Yes.
So has they kind of got inspired seeing dad, or sort of it's been always dinner table conversation is about treating patient, and how or they actually kind of saw you and wanted to be that?
They've already passed MBBS and they are waiting to join post-graduation. I'm just probably happy that hopefully they are inspired, but their choice was on their own. We did counsel in the same way that you should be ready to study for 10 to 12 years without bothering about any earning, only about knowledge, and you should love. But then on their own, they chose the path of medicine. So I feel that next generation is also here to serve people.
Beautiful, because I think this is one thing we call next to God.
Next to God.
Right?
Very true.
People come to you with the face that He will change my life, and
not God, but still.
My parents have been always saying that you are next to God.
We offer treatment and He cures, He does bless us. Yeah. So I feel blessed.
May you do the next 50,000 surgeries successfully and change the world by being you. Thank you so much. I got a small token of appreciation for you. I'm fond of nature, so small plantation for your table.
This is probably the most precious and valuable gift which the world needs.
Thank you so much. And thank you for being on the show.
Thank you so much.
Do stay tuned, subscribe our channel, link is below as we come out with more and more such informative session. And thank you so much for pouring so much of love, wishes, and many of you have been asking us conversation regarding obesity. And today we had Dr. Shah who gave so much of light on us. So thank you so much everybody for watching. See you next episode.
Thank you.